Okay, it's going to start from the beginning. Okay, in our third topic of bleeding related to early pregnancy, we've already spoken about vesicular mole
Ectopic.
and ectopic pregnancy. So the third potential cause of bleeding in pregnancy is
Intrauterine abortions. Now, definition of abortion. Abortion is the spontaneous or induced termination of pregnancy before the viability of the fetus is reached, that is, before the 28th week of pregnancy, or a weight of the fetus below 1000 grams. This is the cutoff point because in up to 1000 grams, fetuses won't survive. And around that 1000 grams or above, there are instances where fetuses have survived.
kind of
So
the borderline of viability.
that cutoff point we have taken. Now, incidence of abortions, 15 to 20% of all pregnancies. But newer data suggests incidence of spontaneous abortion is around 10%. 45% of miscarriages occur before the 12th week of gestation. Risk of abortion increases with maternal age, parity, number of previous abortion, teenage pregnancy, and pregnancies conceived after infertility treatment. Historically, increased incidence was noted in women of lower socioeconomic status. However, recent studies indicate the incidence of abortion has increased in women from higher socioeconomic background with higher levels of education and living in urban areas. Now, differential diagnosis of bleeding in first trimester. Abortion, ectopic pregnancy, vesicular mole, and local causes like fibroid polyp. Etiology for abortions. A long list of causes of abortion can be given, but in many cases of abortion, none of them are found to be present. That means there are still many gaps. Most abortions occur in women who are in other respects healthy and normal. It is difficult to make a satisfactory classification of causes of abortion. However, the causes are discussed in the following groups. Chromosomal abnormalities, which are as a result of either defective oogenesis, ova, or defective spermatogenesis. There is evidence that there is a proportion of deformed spermatozoa in almost every seminal ejaculate, and so if fertilization occurs with the deformed sperm, a defective embryo results, leading to abortion. So lethal or sublethal genes originate in the germ cells of mother or father or both, which can cause abortion of the embryo. Incidence of chromosomal abnormalities is high in early abortions, especially prior to 6 weeks. 60% of abortions are a result of chromosomal abnormalities. Many aborted fetuses have X0 sex chromatin abnormalities. Other chromosomal abnormalities are the presence of extra chromosome, trisomy, 47%, next monosomy in 4%, and then triploidy. As maternal age advances, risk of abortion chromosomal abnormalities increases. May also be due to ovulation and faulty spermatogenesis. Chromosomal abnormalities are encountered in spontaneous abortion much more frequently than in therapeutic abortion, which proves the cause. Now, chromosomal abnormalities result in fetal death, that's blighted ovum, or intrauterine death of the fetus. Fetal factors, chromosome abnormalities, gross congenital malformations, blighted ovum, twins and hydramnios, acute because of rapid stretching of the myometrium that can cause abortion. Now, placental factors are vesicular mole, low implantation of placenta, placenta into non-endometrial tissue. Maternal factors. Disorders like hypertension, renal disease, diabetes, thyroid disease, and immunologic related disease like lupus and celiac disease. Maternal infection, high fever, stimulate uterine contractions and release prostaglandins. Syphilis, Brucella abortus infection, rubella, toxoplasma, listeria monocytogenesis. Significant cause of recurrent abortion. Cytomegalovirus with inclusion body disease, tuberculosis and malaria. Vaccines, live vaccines administration during pregnancy. Maternal malnutrition and diet factors, folic acid deficiency, lack of adequate protein, and B12 deficiency, severe anemia, they cause abortions. Poisons like quinine, cytotoxic drugs, especially methotrexate, analgesics like nitrous oxide. Endocrine factors as a cause for abortion. The steroid hormone produced early pregnancy by the maternal ovary and later by the placenta play a major role in permitting the conceptus to grow within the uterus. Progesterone is the most important pregnancy maintaining hormone. So corpus luteal deficiency or corpus luteal phase defect before 12 weeks cause death of the fertilized ovum. In the later part, poor function of placenta will cause decreased HCG and decreased progesterone, resulting in fetal death. Now, uterine factors as the cause for abortion. Presence of intrauterine device, fibroids, bicornuate uterus, and uterus diadelphys, implantation of the ovum, implantation of the embryo on the septum, and incompetent cervix. Immunological factors. Immunologic causes of abortion have received attention in recent years. Blood group ABO incompatibility. The best known example is Rh incompatibility, especially if the titers are high from the beginning. Psychogenic factors, addiction, anxiety, depression, high stress. Teratogenic drugs like methotrexate, anti-malignant drugs. Trauma, radiation, and operations. Environmental factors, air pollution, poor water quality, or living in unhygienic environment. And lastly, there is a group of cases where no cause can be detected. So unknown causes. Causes of mid-trimester abortions, abnormalities of the uterus, like incompetent os, bicornuate uterus, uterine diadelphys, uterine hyperplasia, uterine overdistension, multiple pregnancy, hydramnios, and fibroids.